Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to prime health in life and in business. Now, today we have an amazing guest in Nicole Bankhead. We're going to learn that what if true healing isn't just in your mind, but how your brain, body, and spirit reconnect. Nicole and her team blend science and soul to help people come back home to who they truly are. But before we jump into the episode, I just have a quick message from our sponsor, Grow Solutions, where health and wellness professionals discover how to double their impact and income without doubling their workload. So we help you eliminate the biggest headaches, whether it's new patient lead generation, whether it's setting up some patient communication breakdowns that may be happening in there, or even staff breakdowns, operational chaos that we know happens in every business that's out there, but we implement some systems and frameworks for that. And yes, we are implementing AI for many of the business that we work with and agents to allow you to enjoy the work that you do and family and lifestyle after that. So we're not your typical agency or vendor. We are a growth partner for you. So if you've ever said this to yourself, I'm too busy to grow, I'm too slow to scale, or too overwhelmed to fix it, we are your solution. Just drop the word grow in below or hit me up with a DM on any social platform that's out there. But you came here for a purpose today, and that's to see our next guest, and that's Nicole Bankhead. And I want to welcome you to the Prime Health Podcast, Nicole. And please tell us a little bit about yourself and what you do.
Thank you. Yes, it's good to be here. My name is Nicole Bankhead. I'm a licensed professional counselor, an integrative healer, and a founder of Serenity Wellness and Counseling Center in Cypress, Texas. My work focuses on helping people heal at the root, not just manage their symptoms by reconnecting with their own inner healing intelligence. At Serenity, we bring together therapy, neurofeedback, functional medicine, and ketamine-assisted therapy to support the whole person, the mind, body, and soul, and help others awaken to their most authentic self.
I love that. It sounds like we need many more people to hear about your business. It sounds fantastic on how you approach that. So I always ask this as we start, Nicole, was there a moment in life, a circumstance that took place, or was it just that you felt it was a calling when you were younger that put you into a career into counseling?
I actually felt like that came to me later in life. I started out in the business world. I have a business degree, worked in law for a little bit, and just really felt like I wasn't connecting with what I truly wanted to do. And that was making some sort of difference or change in the world and feeling like that was a part of my purpose. And that kind of led me down the path of getting into counseling and education. And then that shifted into my own private practice, and then changed over the years, where I just felt like traditional talk therapy wasn't fully providing the healing that clients needed, especially those that had a lot of trauma that they were storing in their body and in their mind. So that's when I started using EMDR, saw real breakthroughs with that. And then from there experienced neurofeedback to help heal the brain. And from that evolved into ketamine-assisted therapy and psychedelic-assisted therapy, kind of providing like each step just a deeper understanding that true transformation happens when we bring the mind, body, and spirit into alignment.
I love to hear that. I'm going to ask a couple of questions about some of maybe the services that you brought up, but how do you feel that Serenity Wellness approaches healing different than most traditional therapy practices?
I think in that aspect, we look at the whole person. So it's not just mentally what is going on, but physically what is going on in the brain, what is going on in the body. So we bring some science to it as well. And we also do functional gut support to provide some gut healing. We understand the connection between the gut and the brain. So we really are trying to bring in this whole approach where clients feel like they're coming in and getting healing on just a completely deeper level that can be more profound, more long lasting, feel more whole. And it's not just like I came in for one thing and that might have gotten a little bit better, but I'm still not fully completely healed. And then you have to go somewhere else to see how that goes. Our ultimate goal too is to support clients to either reduce or get off their medication, or we have a lot of clients who come to us who choose to not want to be on meds and want to try to find other sources to healing. Not to say we don't support med management. We do. We just try to find ways to help our clients, and especially those that choose to not want to go down that path.
Okay. So you mentioned one therapy. Well, you mentioned two, ketamine-assisted therapy and EMDR. I'd first like you to explain a little bit about what EMDR is and how that can help people.
So EMDR is eye movement desensitization reprocessing. That has been around for many, many years, and it really supports those who are wanting to reprocess some of the trauma. And what we look at it from that perspective is we're helping clients kind of move some of those negative life experiences from the maladaptive side of the brain to the adaptive side of the brain. And when we do that, and we make that shift and we desensitize ourselves to those events, then our body and parts of our brain don't hold on to it any longer, and we don't see ourselves getting in that fight, flight, or freeze so quickly.
Yeah. When you say fight, flight, or freeze, I think that most people don't understand that freeze is there. It's you being in the profession, you know it's there, but most people are like, well, I've heard of fight or flight. Can you explain a little bit more about what that freeze does to people?
I mean, that's just where I'm kind of stuck. Like, I don't know what to say. I don't want to be there. I'm kind of like just really frozen in time.
Okay. Interesting. And that could be for any condition. It doesn't have to necessarily be somebody that has a traumatic issue. It could be, a young individual that's just having a rough time in school. Is that true?
Yeah, I try not to use the word trauma all the time.
Right.
Even with my clients, I say negative life experiences because that can be defined completely different for you and for me and for other people. So, in school, it could be the stress of, I want to please everybody, so I'm going to want to get all A's, and that's, and then that doesn't happen, right? And I get a B or a C. And so that can be an experience for that child. There can be issues with friends. And so maybe it's not necessarily bullying that we would lump into that trauma side, but it could still feel negative, right? And then that can have long lasting effects as well. So yeah, there's a number of things that can create that within people.
Okay. You had mentioned that you do ketamine-assisted therapy and some psychedelic therapy, which is fantastic. What's maybe the biggest misconception that you're getting right now with people that are either wanting to learn about it or like, I don't know if that's right for me, either one of those?
Well, I think part of it is that you hear the word psychedelic, right? And so then there's a lot of stigma behind, the benefits and what can be put out there. And so what we try to do is really educate our clients in understanding how to work with these compounds, whether it's with ketamine or if you're in a place like Oregon or Colorado where you're able to work with things like plant medicine. Right. So in my training, I actually was trained to work with both psilocybin, MDMA, LSD, through a year-long certification. But I can only work right now in Texas with ketamine. Now I do travel frequently into other states that allow me to. And then there's the hope that some things are going to change over the next few years to allow some of these other things to become available. So it's really about educating the client. But I also really try to help my clients understand that we're not just using these compounds as just another medicine, that they have what I like to call the spirit of the psychedelic. And so whether it is a plant or whether it is ketamine, it still has this ability to make a lot of changes in our lives in terms of its what it does in the brain. And each compound is a little bit different in how that works in the brain. And then also what it can do when we combine therapy with working with that psychedelic. So I tell people all the time that it's not just your dosing day that's important. It's the prep and the integration. The whole thing is the big picture to how we help our clients really, truly heal. And I want to help educate my clients in that way. So I kind of give them a lot of the science behind it, but I also look at like some of the cultural aspects behind it and some of the ceremonial aspects that have been used for centuries behind working with these different plants. And I want people to kind of see and understand what it's capable of doing. And that's making pretty profound changes in people's lives.
Yeah. Nicole, is there a condition or a life experience that says we should do ketamine versus the psychedelics? Is there something that breaks down that differently for you and how you choose that approach with your clients?
I think a lot of that comes with the client's openness, but mostly, I'm seeing a lot of clients that are coming with treatment resistant conditions, I like to say, because it can be anxiety, it can be depression, it can be trauma. It's that they have tried all things, right? They have tried therapy. Some even try EMDR. They've tried different medications. None of those things are giving them the big life change that they're looking for. It's not helping them really connect with their authentic self and heal these parts of them. And so, with that, that's when we start talking about, is ketamine the right option for you? I kind of look at it. First of all, I can only work with ketamine in Texas right now. So we're kind of limited to our options. But it also is a gentler guide into the world of psychedelics. And it doesn't last as long as some of the other ones. So, working with the mushrooms or with LSD or MDMA, you're talking about a 6 to 8 hour experience. Ketamine is about 90 minutes. So it kind of gives you a bit of like an introduction to the world of altered states of consciousness. And for some people, that helps kind of ease some of the anxiety of working with these medicines too.
Okay. So when this is dealing with individuals that are, whether they're depressed or they have trauma or negative life experiences, as you like to say, how do you start the approach with them on how you build trust for them to work with you?
I think a lot of that just comes with that strong relationship building in the beginning. I am a pretty open individual, and especially if that person wants to work with things like ketamine, or even neurofeedback or even EMDR. So I don't bring anything into my practice that I haven't actually practiced on myself. With other professionals. And so I can then bring about stories and understanding, and I can empathize. I have, my own past trauma experiences. And so if I feel like that it is going to be helpful for my clients, then I will ask, do you think it would be helpful for me to share a story with you right now? And that tends to bring about some connection because they look at me as like I'm this real human being, not just this white coat sitting across from them, right? And that's my goal, is to just really work on building that comfort level and connection with people, knowing that it really doesn't matter all the time what modality they use. And as long as they're feeling like they can trust and feel that connection between the two of us, then we tend to see the work happen a lot better that way. And I train all of my clinicians that work for me in that same aspect, that the relationship comes first. And that's just kind of being human.
Yeah. Well, thank you for sharing that. It's important because I who hasn't wanted to see a counselor? Some are afraid to do that. It's a trust factor, like how's it going to release, especially if they are doing ketamine or some of the psychedelics. It's a big trust factor. So it's great that you meet them where they are. You can explain to them that you've had your own experiences. And I think that helps them buy into you and your business much easier, which is fantastic. Nicole, from a business perspective, have you noticed a higher demand for people seeking out counseling care in the next, or in the last couple of years?
We saw a real uptake in the COVID years, obviously. And for that whole year after in 2021, it was a lot coming into the businesses. It slowed down just a little bit. And I think a part of it's not that people don't need the help. I think that there's a lot more out there that do. I think there's just a lot of financial burden. And a lot of that financial burden comes from what I'm seeing, at least in our practice right now, is a lot of people needing to use their insurance. And we cannot, as therapists, accept some of these insurance policies because they pay out so low of an amount. And these therapists are racking up student loans. They're just as high as a medical professional, but not being able to be looked at the same. And then that is leading them to have to try to take on a very large caseload just to be able to pay their bills along with their student loans and all of those things. So it just tends to not be in their best interest to take insurance, because then they'd have to see 30 to 40 clients a week to cover their expenses. And that's not healthy for both the client or the clinician. And I am really big on work-life balance at my office. And I really want my clinicians to do a lot of self-care and to really take care of themselves, because I don't want burnout. And we're one of the number one professions with that. And so if my clinicians took insurance, then they would burn out really fast. And that's not going to help you as the client either. And so that's a really unfortunate situation right now, where we're seeing a lot of people that we're having to turn away because we just cannot accept those insurances. We try to bring in people in our practice that are in a different range. So we will have some students at our practice so that we can charge lower rates. We have associates so that they get charged a lower rate. And so we try to have several different options for people. We try to provide super bills. We try to do the best we can because we really, truly want to help. And all my clinicians will take on at least one pro bono client at a time, but I do not let them do more than that, just because, again, work-life balance, right?
Yeah.
And we have to take care of ourselves. And, but so that's our best way we can do right now to try to give back and help as many people as we can. It's just a really unfortunate place to be.
Yeah. Yeah, it is unfortunate. People on the outside of healthcare, specifically in your clinical setting, that they don't understand what insurance is. It's not health. It's health insurance, but it's not health care. It's really unfortunate. People have to understand that, take a few dollars out of every paycheck, put it aside to be able to do self-care. And I love how you mentioned the word burnout, because I can only imagine if you have to see 30 patients on your caseload, and day after day after day, most are coming in with negative experiences, and to be able to wash that or flush that from your own mindset, that's got to be very difficult. So it's great that you're saying self-care and work-life balance. That's important to your business for sure. Yeah. Where do most of the patients come into your practicing to see your clinicians? Are they locally? Are they regionally? Is it telemedicine? How does that work in your business?
Most of ours are local. Yeah, we do offer telehealth for those who would like to. And obviously, right after COVID, we saw a big intake in that. But now what we're seeing is that people really want to come in, and so majority, I'd say probably 90% of our clients are coming into the office. And then if they needed to not come in that day, somebody wasn't feeling very well, or they had a last minute change, whatever it may be, we can offer the telehealth option. But most of our people are all local in the Cypress, Texas area.
Okay. From a business growth perspective in your own practice, or I guess your business in general, what's the focus on right now for your business?
Right now, we are really trying to focus on getting people to see the benefits of using some of these other modalities alongside their therapy. So we're really encouraging people to try the neurofeedback with therapy, right? And so in that ways, we try to offer a discounted rate to come in for that neurofeedback session for the first time, give it a try. The neurofeedback technician also does functional medicine. So you're kind of getting a 2-for-1 deal. You know, he will talk a lot about the gut when he's helping you with your brain. And then he can work on some gut work support outside of doing neurofeedback sessions if you feel that's what you need. So that's what we're really trying to encourage people to do, is to utilize multiple services at our office. We are seeing such great results for clients that come in and do neurofeedback with EMDR or neurofeedback with ketamine therapy. Like both of those, you doing both of those two together are really showing profound, great changes really fast, a whole lot faster than years worth of therapy.
So you mentioned earlier, Nicole, that like one of the biggest challenges you have is the insurance-based component, but from the growth or scale of the practice, are there any other challenges that you're working through at the moment?
I think the biggest challenge I have right now is finding ways to market some of these other techniques, some of these other modalities. Neurofeedback, we've tried doing Google ads, we've tried doing Meta. It's a really hard thing. And then with ketamine therapy, Google's still not a big fan of that word. So I cannot do a lot of marketing in terms of that. I can with Meta, but it's not been as successful finding people that can afford it. And so I think those aspects of the business right now is where I'm seeing a lot of some struggles with that.
Sorry that that's happening. I mean, it is. We play in the world of Google and of Meta, unfortunately, to bring patients in. And, I'm sure you've got a great word of mouth perspective to the practice as well. But there's always ways in which we'd like a couple more to be trickling in per month from that. How have you seen AI affecting the way you practice and care for your current clients?
Well, there's two folds with AI. One, it's been really helpful from a business standpoint, from like admin work, marketing, creating content, updating websites, like all of that kind of stuff. It works really beautifully. And then there's the AI where people are going in and using it as their therapist. And listen, I do not tell my clients don't do it. I just say use it as a tool, kind of like a journaling. Like I might be, instead of having my journal out, I might be journaling through my AI and then bring that back, right? Like, let's discuss that in your session. What might have come up? What was some of the tools? Can we add on to those tools? Are those tools healthy for me to use based on my experiences? Can I teach you how to implement those tools? Things like that, instead of it just being the only thing that you're going to. So yeah, I think there's a bit of there's some beauty in it, and then there's some struggles with it in terms of people trying to treat it as their therapist.
Yeah. AI is coming, whether we like it or not. So we have to use it to the best benefit we can within our business and in our life. And you can understand why patients are asking it for help. But as it says right in, if you're using ChatGPT or Claude, or somebody says, all these answers may not always be correct. So you have to be careful. And it's great that you speak to them and say, yeah, please do use it. But when it raises a question, bring it back into us and we can discuss, is this the best track of care that you would go on to? So I want to come back to the practice itself. Can you share a success story that really stands out to how you've helped someone in your practice, depending on what service or attribute you've used for that?
Yeah, we've actually had several, and that's one of the most rewarding parts of this work. We're seeing over and over again when clients combine that neurofeedback with EMDR or neurofeedback with ketamine therapy, something just profoundly happens. The neurofeedback tends to help calm the nervous system and open up the neural pathways so that by the time we introduce the EMDR or the ketamine work, the mind is more open and the process unfolds with greater ease and compassion. And many clients have shared with us that for the first time in their lives, they truly feel connected to their authentic self, and able to understand and live in harmony with the different protective parts within them. They begin to experience deeper peace, self-compassion, and more fulfilling relationships, both with others and themselves. I had one client who had struggled for years with an eating disorder shared that she had always felt wrong or broken in therapy. But through neurofeedback and ketamine sessions, she was finally able to see that part of herself through a compassionate lens. And that shift in perspective changed everything and opened the door to real healing. And then I had another client who could barely speak in their earlier sessions, no use of words at all. And that's just because of trauma, and slowly found their voice after months of neurofeedback and several rounds of ketamine, and then some EMDR work too in between those. That today they not only speak freely, but have built a stronger, healthier relationship with their partner and with themselves. So these stories kind of remind me why I do this, because there's true healing that doesn't have to take decades or depend on a handful of prescriptions. When we address the brain, body, and mind together, transformation becomes not only possible, but then sustainable.
Yeah, I love that. Are there other companies out there that are kind of combining all that, or do you think that that's really a differentiator for you, that that's something that's unique to your practices?
Well, I mean, there might be some around the country, but I do know of a couple in particular I met at the psychedelic conference that utilize neurofeedback and psychedelics together, but not a lot. And so, yeah, I mean, especially in our area, you wouldn't find anybody else doing that.
Okay. All right. Well, you're a hidden gem. We got to make sure that we get more people to see you and your staff. From a vision standpoint in your business, where do you see your business going in the next 3 to 5 years?
Really trying to just evolve this like full integrative mental health institute offering. I'm also starting to work on offering some clinical trainings for those who want to work with ketamine, and maybe adding more on to this functional medicine program and expanding psychedelic therapy as that starts to become more and more available.
Okay. So you're looking at helping other clinicians that want to do what you're doing and excelling in your practice. Is that right?
That is coming. Yes.
Okay. Fantastic. Love to hear that. So, Nicole, I appreciate what you shared so far. I'm going to share all of your contact links inside of the description that we have. I'm wondering if someone is interested in learning more about you, whether it's a clinician that wants to learn more, how about you're doing the psychedelics or the ketamine therapy, or anything else that you're doing, the biofeedback with EMDR and the other services, or if it's a patient that says, hey, I'd like to learn more, where would you like them to go?
They can reach us on our website. That's serenitywellnessandcounseling.com, or reach out to me, Nicole, at serenitywellnesscc.com. Or you can reach me through our main line, which is 281-944-7922. And if you want to speak to me directly, just ask, and they'll put a consult onto my schedule for me. And we will touch base sometime. I love speaking about all things, neurofeedback, ketamine, psychedelics, helping other therapists, whatever it may be. Or if there's just somebody out there that is looking for, trying to figure out what's the right path for them, I'm more than happy to speak with them. And if it's not working with me, it can be working with somebody else, or I can help them try to find somebody in their area.
Okay. Thank you for sharing that. That's important. There are too many people that need help, are either afraid to do it. Some are embarrassed to do it. I'm sure there's both a combination of men and women. I do think men are less hesitant to reach out to it, but unfortunately men need it a lot. Women do not let themselves break free from the stress of life and taking care of families if they're in that situation. So you're doing a great service to people by offering that contact point. So I appreciate that. Nicole, 2 last questions here. From an overall health perspective, if you could give anyone one piece of healthy advice that would, move them in a positive direction, what would that advice be?
I think that's, really working with the mind and the body. So trying to truly understand what the body is there trying to tell us.
Love it. So listening to a little metacognition, what we think about at all times. So listen from the inside out, which is great. You've been a guest here on the Prime Health Podcast. Everybody has a different definition of this, but what would your definition of Prime Health be?
I've probably said this a lot already, but it's when your mind, body, and spirit are in alignment, when you're not just surviving, but feeling connected, balanced, and fully alive in who you truly are.
Well, Nicole, you've given some great insights, personal perspective as to what you're doing, and you're doing something very unique in Cypress, Texas, in that area. So I commend you for coming on to the show. I appreciate it. I always say this because I think it is so, so important. As people listen to this, if there's just one person, of course, you and I would love it to be shared to more, but if there's one person that could benefit from this, whether it's a clinician you know, or whether it's a patient that's just been struggling through talk therapy, CBT, whatever it may be, that they're feeling stuck or in that freeze perspective, share this information with them, because it can be life-changing in a positive way, because it's no fun to be stuck by any means. So I also ask selfishly, please subscribe to the Prime Health Podcast, whether you're watching it on YouTube or on any of our other places. But as we wrap this up, I like to say this: until next time, remember that true wellness is a journey that we are all on together. Now, whether you're taking charge of your own health or guiding others in theirs, every step forward matters. So I always say, stay committed to your Prime Health journey. And again, Nicole, thank you very much for being a guest on the Prime Health Podcast.